I think Dr. Binello has some trouble connecting.
Okay.
Yeah, Isabel, I think Peter is stuck in the general. Is there a general session? Because he can't.
Let me see what I can do about that. Attendees. So Dr. Binello now should be able to be with us. And who else was stuck in there? Isaac, I see.
I think Peter Fecci.
Peter.
Although we can probably keep him on mute for most of the day.
I think I promoted, or I'm trying to promote Peter as well.
Thanks, Isabel. I got the promotion. Thank you.
All right. That's what I like to do.
So the slides are still in presenter view.
Okay. Thank you. So,
You're stuck with me now.
okay, we got Peter promoted. We got the slide promoted. What else do we need? Are we good?
A glass of wine, but otherwise we're good.
All right. I see Gabe. Gabe, do you need to be promoted? Let me see if I can do that. Okay. Awesome. All right. I hope I promoted everyone, and if not, please let me know. Okay. Good evening, everybody. My name is Isabel Germano. We're live on YouTube, and tonight we are here all together to celebrate our future leaders in neurosurgical oncology. I'm going to let Dr. Brian Nahed and Sue Panulo take it from here.
Thank you, Dr. Germano, and welcome to everyone to our amazing panel and our future leaders in neurosurgical oncology. Most of you are already leaders, and this is just our attempt at not only drawing a light to it, but also celebrating all you've done. As in past sessions, we'll have, when available, the mentor introduce the future leader, and if not, both Susan and I can jump in. But welcome, I want to get started. I'll turn it over to Susan for just a few words, and then hopefully we'll start out with our first fellow.
I just really wanted to thank you guys all for joining. And if you've been here for prior sessions, you'll know this is a dynamic, kind of fast-paced program. So I encourage you to keep it going, keep it fast and nimble.
All right, are we starting with Aristotle? I see the circle.
That's right, Emanuela. Thank you.
Okay.
Thank you so much. It's my distinct pleasure to introduce Dr. Aristotelis Philippidis, whom I've known for about 10 years. Aristotle received his MD degrees in Greece from Aristotle University of Thessaloniki and his PhD in the physiology of cortical subarachnoid space from the University of Thessaly in Greece. He started neurosurgical training in Greece, but soon embarked on an international neurosurgical fellowship at the Barrow. He did a number of postdocs, UAB, VCU, studying brain edema and aquaporins. And in 2012, he moved to Boston, became a fellow with us in the neurosurgery department of Boston Medical Center, Boston University, where he organized the non-invasive ICP clinical trial that led to $1 million funding for device development in TBI and brain tumors. In 2016, Aristotle became the inaugural resident in the combined BI, DMC, and Boston Medical Center and Boston Children's Hospital neurosurgery residency program, where he developed an interest in brain tumors and functional mapping. In 2020, he joined BrainGate Hochberg Lab at Brown and developed motor mapping techniques with brain-computer interface to further explore the capacity of eloquent cortex in neurorestoration. He finished his residency about 1 month ago, including an enfolded neurosurgical fellowship at the BIDMC, and is currently a fellow at the Barrow Neurological Institute with Dr. Chris Smith, learning minimally invasive techniques in brain tumors and functional neurosurgery. After this, he'll embark on a fellowship with Dr. Smith. And without further ado, here is Aristotle.
Well, Dr. Germano, Dr. Panulo, and Dr. Nahed, thank you so much for the kind invitation. And of course, Dr. Binello, thank you for all these years of support, mentorship, and this long introduction. For me, I'm Greek, so I have to make a Greek reference, right? It's a long journey to Ithaca. Hope this is not going to end as a Greek tragedy, but yeah, we'll see. So yeah, it was a long journey for me. I'm always passionate about devices and neuroengineering. My approach to brain tumors is mostly from the functional outcomes perspective. I did both clinical and research fellowships. And what was mind-blowing for me was when I joined Lee Hochberg's lab at Brown, and I was exposed to brain machine interfaces and motor mapping, and I could really see what amazing capacity you have in the brain cortex and how the dogmas of neurophysiology can be altered. And we even doubt the presence of the pen-filled homunculus nowadays. So, we do research, we do like basic or clinical research, we expose ourselves to many cases, but I want to start with you a defining moment in my, I would say, personal life and career. I was chief resident, I was rounding, and this morning I met a patient who was just the same age as me, had 2 young kids. He was diagnosed with a white-type glioblastoma. And he just really asked me a few simple questions. He was like, am I going to make it? Am I going to see my kids' birthdays like next year? And I was amazed because, these are like valid questions. And over the course of 50 years, few things have been done as far as like outcomes in intrinsic brain tumors. We see some light the last couple of years, but this means that this type of disease needs a holistic approach and teams-based approach, multidisciplinary approach, and we need to introduce ourselves to each other and make it happen together. The last slide shows my personal, I would say, tidbits. I love it with my family. My free time, my wife, Irinis, is wonderful. She's supported me all these years. She's assistant professor of immunology at Tufts, and this is Alexander, my son. He always, I always fall asleep faster than him when I go back and read him bedtime stories. So he always beats me. I hope one day I will beat him. And my passion is traveling. I try to explore every single Greek island, and I love devices. So at the end, this is a picture of an infrared device I created while I was applying for the HyperSpin initiative. Again, thank you so much for the invitation. It was a wonderful journey for me, and I had so many mentors. I can mention Dr. Bonello, Dr. Rafael Vega with the oncology perspective. Dr. Holzapfel, who gave me the opportunity to be a resident, and many mentors at the BNI, Dr. Smith. I'm working with him right now and trying to be exposed to minimally invasive techniques in tumor resections. Again, thank you so much.
Thank you, Aristotelis. This was great. And thank you, Dr. Bonello, for the introduction. We move on to Ivan Bander.
Yeah, I guess I'm up next. Dr. Tabar, who nominated me, is actually out of the country right now, so I can introduce myself if that's okay.
I can help also because he's one of our residents and he's a fantastic resident. And, he's done some really great work in a variety of spaces actually during his residency so far. I'm sorry that Dr. Tabar couldn't make it, but I'm really proud that he's part of our program, and I'm happy to kind of co-sponsor him along with Dr. Tabar.
Thank you, Dr. Panullo. And thank you to the tumor section for allowing me to talk today. So I'm actually I just finished residency actually last month at Cornell and MSK, and now I'm a neurosurgical oncology fellow at MD Anderson this year. So in terms of my interest in neurosurgery, one interest that I have is particularly in minimally invasive surgery, and I completed during my residency and enfolded fellowship with Dr. Schwartz in endoscopic and keyhole surgery. And I really think that it's important to minimize our surgical footprint on patients, but also to critically evaluate the appropriate use of these minimally invasive procedures and the advantages and disadvantages of those procedures. But ultimately, I think despite my love for surgery, I'm particularly driven in neurosurgical oncology by the fact that no matter how good our surgery is or how many adjuncts we use, in most cases, the surgery is just not going to be enough for our patients. And that's particularly true in gliomas or recurrent tumors. But we really need to utilize our access as neurosurgeons and our position in patient care to derive as much knowledge as we can from every patient sample that we attain. So I was lucky enough to work with Dr. Jabbar in her lab, and we designed pipelines to utilize tumor and blood samples from our patients, as well as unique model systems such as ex vivo tumor explants and embryonic stem cell derived microglia to actually model the tumor microenvironments of both IDH mutant and wild type tumors. And we performed single cell RNA and chromosome accessibility sequencing to better understand the mechanisms of progression of immunosuppression in these tumors. And we're really building an understanding of how the innate immunosuppressive environment is co-opted and how we can sort of interfere with this maladaptive immunosuppression. So another thing that's driven me in neurosurgical oncology is sort of the drive to integrate advances in science and translate those back to the patient. So while I was a resident at Cornell, I got to work with Dr. Swaydan on a phase 1 clinical trial, basically using convection enhanced delivery of a radio-labeled immunotherapy for diffuse midline glioma patients. And I think this work was really emblematic of my goal to combine minimally invasive surgery and advances in science to improve the care for neurosurgical oncology patients, especially taking a disease like diffuse midline glioma that really had no surgical indications other than biopsy and turning it into something that we can now treat. And we're preparing to submit our final cohort data as well as some evidence that I presented at CNS this past year on some improved local control from CED in this patient population. And if you go to the next slide, so kind of just reiterating my aspirations in neurosurgery are to really provide compassionate care to our patients and to translate advances in science to improved outcomes in our patients. And ultimately, I think that relies on sort of a collaborative and academic environment and great mentorship, which I've been lucky enough to take advantage of at Cornell and MSK. And I hope to continue having benefited from that and hope to give that benefit to future generations as well. And outside of the OR, you can see in the pictures, I have an amazing supportive wife, Sarah, and a 2-year-old son, Adam, who you can see pictured here, as well as our mini golden doodle dog. And right now in Houston, looking at that picture of Adam and I in the snow feels very far away because I'm currently in 100-degree humidity. But I'm happy that they were able to come down to Houston with me and while I do my fellowship here. So thank you again for letting me speak today.
Great presentation, Evan. Thank you.
Thanks.
We're continuing on with Stephanie. And Stephanie was nominated by Dr. Jennifer Moliterno-Gunel, who's our chair of awards for the tumor section, and Dr. Gabriel Zeta. And I saw Gabe on the call.
Hey, how's it going? Hi,
Good.
Isabel. Hey, Brian. Hi, Susan. Thanks for hosting this. Sorry, I'm on the road right now, but I wanted to make sure I joined for Stephanie's portion here. So I'd like to introduce Dr. Stephanie Chalk, who was our fellow at USC last year. Stephanie's a California native, and she went to her undergrad studies at UC Berkeley, where I also got to go, and then UCLA for med school, where she got to work with Dr. Isaac Yang there. She did her residency at Yale and did some really phenomenal work there, not only with Dr. Moliterno, but also with Dr. Veronica Chang. And she's done fantastic work looking at CSF markers for brain metastases and helping kickstart their program. And needless to say, she was an exceptional fellow with us last year, doing everything from minimally invasive to complex skull-based cases. And she's armed and ready to go. And we're so proud of her because she took a phenomenal academic job in Milwaukee at Medical College of Wisconsin. So I couldn't be more proud. She has a couple of great articles coming out in the JNS, and really she's going to set the bar pretty high. So Stephanie, glad to hear what you have to say here.
Thank you, Dr. Zada. It's so good to hear from you again. And good afternoon and good evening to everyone. Thank you, Dr. Germano, Dr. Nahed, and Dr. Panolo for inviting me to speak at this panel. And of course, to Dr. Zada and Dr. Malterno, not only for nominating me, but also for being major influences in how I am working to develop my career in neurosurgery. It is also a huge pleasure to be around such impressive future leaders, and I'm excited and humbled by everyone's presentation so far and to come. As Dr. Zada had mentioned, my name is Stephanie Chalk, and I completed my residency at Yale and my skull-base and neurosurgical oncology fellowship at USC with Dr. Gab Zada. Throughout each step of my training, I've worked with fantastic mentors and hope to be one to my future trainees as well. As Dr. Zada also mentioned, I will be starting at the Medical College of Wisconsin as an assistant professor, focusing on skull-based tumor neurosurgery. My passion for neurosurgical oncology began early in residency with research on identifying early diagnostic markers of brain metastases and leptomeningeal disease. By comparing contents of CSF and serum in patients with early disease, late disease, and also leptomeningeal disease. As neurosurgeons, I feel we have a privileged access to specimens donated by our very generous patients, given the nature of our profession. Utilizing this, I spent 2 dedicated years in a cancer biology laboratory, focused on tumor environment dynamics, and was able to develop a robust fluid biorepository and pipeline of every patient undergoing intracranial tumor surgery over 4 years. And this biorepository is also available for use by any lab at Yale. Though we initially started with protein and cell-free DNA biomarkers, my next step is to branch out to lipids and products of metabolic pathways that can be detected in the CSF and hopefully the serum. In fellowship, my passion was further augmented. We focused on integrating large single and multi-center data on pituitary tumors, particularly in the setting of advances in the WHO tumor and transcription factor classification in pituitary adenomas and high precision volumetric data, which was worked on extensively by one of our fantastic medical students. I was able to work with so many brilliant colleagues, not just in neurosurgery, but also in radiation oncology, neuro-oncology, endocrinology. And my experience at USC from both an operative and clinical research perspective has been invaluable in my training and career preparation. And just as importantly, Dr. Zada is also a model of a compassionate physician and the strongest patient advocate, both inside and outside the operating room. With these interests similar to Dr. Vander, I wish to focus on applying minimally invasive techniques when feasible in both fluid diagnostics for brain tumor and disease monitoring, as well as skull-based neurosurgery. And of course, I always want to thank those who guided me on my path so far. My aspirations for the near future revolve around providing the best care I can to patients at my home institution for our society and extend this care to patients in the Philippines where I grew up, both clinically and pushing the boundaries through research. Second, I hope to continue to teach and mentor students and residents, as fostering this relationship has provided a driving force to who I am today. I enjoy and plan on giving informal didactics, interactive sessions, as well as teaching in the cadaver lab, which I feel is integral into understanding 3D anatomy. Finally, a little bit about myself outside of neurosurgery. I love playing golf and have played with my dad since I was very young and have now gotten my husband to enjoy the sport as well. Since my family is mostly in Manila, a 15-hour flight away, we usually try to meet somewhere in the middle, and some of my best memories are exploring new countries with them. And the bottom left photo is a photo of us in Japan. Thank you for everyone's time, and once again for inviting me to this panel with very impressive future leaders.
Thank you, Stephanie and Gabe. This was great. And we move on to Sophie Peters, and Isaac Young is the person who nominated her.
Thanks, Isabel. I wanted to applaud. I was looking for the button to applaud everyone's presentation. And I think the appropriate response right now is the future is bright, but I think that's an understatement. Just listening to all this, it's so impressive. And what I'm really curious right now is I'm trying to figure out where Dr. Zada is. I'm like looking at his blurry background going, where is that? But that's really cool that go ahead.
You want me to? Oh, I'm on daughter duty. My wife's inside with
No, I was just trying to look at the background. I think it's so cool because you're traveling and everyone's trying to make this work, and it's just awesome. And so, yeah, I won't digress anymore. I'm so honored. It's absolutely my privilege to introduce Dr. Sophie Peters. She is one of the best residents I have ever worked with. She is our chief resident at UCLA who graduated and is now doing an enfolded oncology fellowship here at UCLA. Next year, she will leave UCLA and do a fellowship at MD Anderson. She's a remarkable human being and one of the absolute best residents we've ever trained. And really, the future is bright as she goes into neuro-oncology. Dr. Peters.
Thank you, Dr. Yang. That was way too generous. I want to thank everyone for the invitation, for the chance to be here today, and then Dr. Yang for nominating me. It's an honor, and very impressed with everybody's presentation so far. So my passion for neuro-oncology started a while ago. I was actually doing some basic science research at MD Anderson as an undergrad, and then now going full circle, going back next year for school-based fellowship. So that's kind of neat. And then went to residency and rekindled that passion with neuro-oncology while in neurosurgical residency here at UCLA. There's two things that really I love about the field of oncology. One is the clinical aspect and getting to be with patients during some of the most intense times of their lives and getting to have that direct, almost immediate impact on their survival and their outcome. And then the second part is to get to study the tumors that we resect during surgery and get to go and do work on some new therapies to add to the surgeries that we do. So my research currently in the lab has been focused on use of cold atmospheric plasma, which is basically an ionized gas that we use to selectively kill tumor cells. We've now shown it in vitro, and we're as well as in an organoid model. And the next step is going to be to do mouse implantations of tumors and use the plasma on the mice brain, which is going to be happening this year. So I'm excited about that, with the ultimate goal to turn this into a clinical trial. They can go to the next slide. So my aspirations as far as a neuro-oncology neurosurgeon is to hopefully establish a practice that includes both skull-based, which is one of my passions, as well as a kind of a more global neuro-oncology group of patients. I'm striving to get as good outcomes and be the best surgeon I can. Hopefully this extra training will accomplish that. And, my hopes have always been to set up an international tumor bank to get more collaboration and learn more about brain tumors around the world and the impact that environmental factors have on them. I have a big involvement in global health, and it's a big side passion of mine that I would like to continue within my career. And I hope to incorporate research with that clinical passion. I got to see some incredible things while abroad, and the tumors of a size you'll never see in the US, and it just reinforces the need for all that and more awareness and funding, internationally as well to improve neuro-oncology access for those patients. I also hope to collaborate with the lab wherever I end up and get to pursue some of this research that I've been doing throughout residency. A little bit about me. I'm born in Belgium. I've been raised around the world, attended 9 different schools before medical school. I speak multiple languages. English is actually the 4th, although I've been going to school in English for a while now. And outside of neurosurgery, I love adventuring outdoors. I have to thank my incredibly supportive husband for putting up with me while doing his own, orthopedic training and now his job. And then my 9-month-old baby, which is the best thing that's ever happened to us. Thank you very much.
Thank you, Sophie. Which glacier is that?
That is in Alaska. What's it called? Matushka Glacier, I think was the name. Highly recommend going glacier.
Thank you. This was wonderful. We're going to continue on with Ganesh Shankar.
Isabel, let's skip Ganesh just because I think he's running late. And we
Okay.
can come back to him at the end.
And then we go to Anup Patel. Peter, are you still with us?
Yeah, still with you. Sorry, and I apologize for the iPhone here. I got the dreaded PC message that I have to update my Zoom and only IT can do it or something like that. So
We all got that today. Yeah.
yeah, it's just what an annoyance. And if Anup didn't regret having me introduce him before, he certainly will now. So anyway, Anup Patel is actually already in practice for a few years. And we apologize for kind of nominating him late, but we actually only realized in the last year that he had any promise as a future leader. So it's been a little delayed in figuring out that he had any talent. So anyway, he and I went to residency together. I was 2 years ahead of him. We were at Mass General. We had the pleasure of learning from an outstanding group of faculty and residents, and also from Brian Nahead. And then let's see, I knew Anup from the time he was a medical student when I was doing my research. And he got suckered into working with me in the lab for a bit, and then continued on to do his own research when he was in residency, where he worked with Mario Suva, and actually really did some outstanding work. I would say that it's almost acceptable to say that anytime anyone references the fact that GBM is heterogeneous on the single cell level, it is Anup's paper that anyone references. It's the Science paper that talks about single cell RNA sequencing for GBM and the heterogeneity of those tumors. That paper is, thousands of times cited in the literature already. And he went on after MGH to go ahead and do a fellowship with Shekhar and work with Manny Ferreira, who had been also a mentor of ours at MGH. And then after 5 years, saw the light, and we were able to recruit him down to Duke, where he and I have rejoined forces. Which is either very good or very bad. It's unclear yet. But in any event, I think he's really just an outstanding star in neurosurgical oncology. He's a fantastic surgeon, an unbelievable researcher, and a tremendous friend. So in any way, Anup, you're up.
Wow, Peter, thank you. You sort of hid your kind of backhanded insult at the beginning and masked that in a series of very kind statements afterwards. But I will go back and say the reason it took me 5 years to develop my talents is I had mentors like you and Brian teaching me how to do it. So it just took me a little while to catch up. But here I am. So yeah, it's a real pleasure to be here talking with everybody. And thank you for the invite. And I would say that my path here probably took a little bit longer than maybe it should have. I took a little bit of a side road, but one that I think was very valuable for me. So I did spend 5 years at the beginning of my career at University of Washington. And my clinical practice was primarily skull base, but I continued my deep-seated interest in studying glioblastoma in the lab and on a basic science level. And after years of trying to sort of make it work, having a clinical practice in skull base and a basic science lab in glioblastoma, I finally realized that it makes more sense to have your clinical practice aligned with what you want to study in the lab. And so I was fortunate enough to be recruited to the Duke Brain Tumor Center and was able to kind of pivot my clinical practice into intrinsic tumors. And so now, while I still do a little bit of skull-based work, my clinical practice is now refocused primarily on gliomas and brain mets. And so clinically, I've really enjoyed kind of getting back into the brain, for lack of a better term. I've always had a great passion for teaching residents. Despite what I said earlier, I had great resident mentorship from above when I was a resident, Peter and Brian specifically. And so they always taught me to kind of pass that forward and from a mentorship standpoint. And so it's been really interesting to take some of the things that I was doing in skull base previously and try to kind of adapt those or use those in interesting ways for intrinsic tumor surgery. So that's really what's been really fun. On the research front, Peter, again, very kindly mentioned a few of the things that we had done in the past. my recruitment to the Duke Brain Tumor Center was really to bring genomics expertise and single cell sequencing expertise to the Duke Brain Tumor Center. And we really have a kind of a strategic plan to deploy this in multiple different areas of research. It's hard to be at Duke and not have some interest or some focus in immunotherapy. And so one of the things that we're going to be doing is kind of developing an immunogenomics program where we're going to leverage genomics and single cell sequencing techniques to improve our immunotherapy approaches for brain tumors. I have an interest in developing model systems that more accurately reflect the heterogeneity that we see in brain tumors. I think one of the big issues in translation currently is that we develop all of these things on the basic science side of things, and we test them in preclinical models that have really no bearing on the actual disease process as it exists in patients. And so I think refocusing on that is going to be really critical if we're going to move the needle on this going forward. And then, all of the work that we've done, myself and others in the field deploying single cell sequencing techniques to study brain tumors, all of that's well and good, but it's been really largely observational up until now. We've done a lot of kind of looking at the heterogeneity that exists, but we haven't been able to ask or answer a lot of questions about how that heterogeneity is generated and what sort of impact that has on tumor evolution over time during treatment. And then taking that to the next level, thinking about how we can actually take the knowledge we're gaining from single cell sequencing techniques and actually do something therapeutic with it. And then, of course, again, having moved to Duke recently, with the incredibly, well-developed brain mets program there under Peter's leadership, it's really hard not to want to take some of these techniques that we've been using for other intrinsic tumors and deploy them into brain mets to try to see if we can move the needle on those in sort of a different way as well. The next slide, please. So career aspirations, really, kind of again refocusing my clinical practice on intrinsic tumors and sort of really getting back into that, sort of practically, it's time to get an R01 and to start contributing to the program project grants and SPORE grants that are at the Duke Brain Tumor Center. Bringing single cell analysis to the clinical space, and whether that's using single cell analysis to derive therapeutic strategies or to figure out why all of our trials are failing. I think there's a lot of different ways to think about using that information. I came from a program that didn't have a lot of surgical clinical trials. And so I'd like to continue to develop that. And, like all of us, I think that bench research, finding a way to take some of the things that we're doing in the lab and actually carry it all the way through to an actual treatment. And on a personal note, this is just a picture of my family, my wife, Monica, and my two kids, Krish and Thara. Krish is 5 and Thara is 3. We like to spend a lot of time outdoors. So the top right picture is us skiing in Colorado. It's my daughter, one of her first times out on the slopes. Very proud that she got out there when she was 3 and actually did pretty well. And then the bottom right picture is a picture of myself and my wife, Monica, scuba diving, something that we really enjoy doing together. So once again, thank you for everybody for the invitation to speak here, and look forward to getting to know everybody better.
Thank you. This was great. We're going to move on with Sabrina. Dr. Rodriguez, are you on the line?
Yes, I'm here. Thank you. I guess you can hear me.
We're good, Annalise. Thank you.
Oh, thanks. Well, I would like to introduce Dr. Himan Aka. I have known her for a couple of years now, and I knew about her before she started residency because I happened to do my clinical residency at Wake Forest, and Dr. Himan Aka did her MD PhD at UNC, and she was selected for the Oxford Cambridge Scholars Program. For those of you who aren't familiar with it, this is an extremely competitive program where you do 2 years at the NIH for your PhD, and then she did 2 years at Oxford. And so there's actually only a handful of people selected for this program every year. So I kind of heard about her just in the news before I ever met her. During her time in the OxCam program, her PhD was focused on Parkinson's disease pathogenesis. She worked with the NIH neuroregenerative program, and one of her works actually resulted in a publication in Nature. And then following her MD PhD, she joined the University of Pennsylvania neurosurgery residency program, She is now in her 6th year. And early on, she had developed an interest in skull-based neurosurgery. And currently she's getting a Master's of Science in Bioengineering at UPenn, basically to expand her knowledge in machine learning and artificial intelligence to better understand outcomes for patients undergoing surgery for skull-based tumors. As well as all of those things, Dr. Himan Aka is also in the CNS resident committee, and she is also the alumni lead of the NIH OSCAM program, and recently was appointed as the alumni director on the International Biomedical Research Alliance board of directors. So it's my pleasure to introduce her, and just can't wait for her to join us.
Thank you so much, Dr. Rodriguez. I feel like I don't need to say anything anymore. Thank you so much for nominating me for this opportunity, and also to Drs. Germano, Nahed, and Pannulo for hosting these sessions. I feel incredibly honored to be considered amongst the other panelists who are on this webinar. And so just to jump in, as Dr. Rodriguez alluded to, I was really first drawn into functional neurosurgery, and I pursued my dedicated research degree in the OXCAM program, as was mentioned, with a research focus on utilizing technological advancements, which at the time included induced pluripotent stem cell biology and the CRISPR-Cas9 genome editing system, to better understand the molecular underpinnings of Parkinson's disease, the goal being to apply that to supplement the functional recovery we can provide patients with DBS towards more curative measures. But through my junior residency, I found myself really drawn to skull-based neurosurgery. It was the anatomical beauty, the surgical complexity, and the clinical decision-making of skull-based neuro-oncology that really drew me into the field. I was enamored by the clinical decision-making, the partnership that skull-based neurosurgical oncologists form with their patients to devise an operative plan that's most in keeping with the patient's goals. And so that really became my clinical pursuit moving forward. From an academic perspective, I realized that there exists a tremendous opportunity for us to explore functional outcomes for skull-based patients as well, whose pathologies can ravage the very pathways that mediate how they interact with the world. So our perception of light, of sound, taste, smell, even our social interactions through damage to the facial nerve. And I ultimately developed an interest in asking how we can utilize data science to improve upon outcomes for patients with tumors in that part of the brain. So as Dr. Rodriguez mentioned, to augment my basic science background, I pursued a master's in bioengineering with a focus on utilizing machine learning to better understand and predict functional outcomes for patients with skull-based tumors. And ultimately, I hope to apply that knowledge to improve outcomes for our patients. So the middle image that's shown on this slide is actually the result of one such exploration that I'm leading, which is a multi-institutional and international effort where we're developing a machine learning algorithm utilizing patient, surgery, and tumor characteristics for predicting facial nerve outcomes in patients undergoing microsurgery for resection of vestibular schwannomas. In addition to my own academic pursuits, I also have a really strong passion for education and mentorship. And so the top image that's on this slide is my participation as a teaching aide in the neuroanatomy course for master's level neuroscience students at the University of Pennsylvania. And that was an opportunity that was afforded by my own master's mentor, Dr. Yale Cohen. I've also been really incredibly fortunate to be able to put that passion to good use through development of a longitudinal professional mentorship program for OXCAM scholars. And as was mentioned, I was recently appointed as the alumni director on the board of directors for the International Biomedical Research Alliance, in large part due to my partnership with the program over developing this mentorship program. I think you can go to the next slide. So where do I hope to go from here? Well, my current training aspiration is to hone my skills across the full breadth of skull-based neurosurgical oncology. And the ultimate goal is to practice in an environment that would support my academic pursuits to continue applying data science to improve outcomes for patients with skull-based tumors. My personal tidbit is really more a note of gratitude for the grace of God and the incredible mentorship and support that I've received along the course of training, which was wrought with the unfortunate occurrence of sudden and severe illness of my mom. So my program leadership, which included Dan Yosher, Sean Grady, Isaac Chen, Jim Schuster, and mentors of mine like Yale Cohen and John Lee, really provided me with the support to enable me to be with my family when it mattered the most. Our entire family is grateful that my mom is making an excellent recovery. And she's featured in the photo that's on this slide as the star patient for the cover of MedStar's system-wide publication, with my sister and I flanking her on either side, and the two surgeons, Dr. Abramowitz and Dr. Offam, who really partnered with us in her recovery on either side of us. So another personal tidbit to note about this is that the sister who's featured here is a neurotologist at MedStar Washington Hospital Center. So she actually approaches the skull base from the ENT side, and it's a personal dream of ours to find a way to work together in the future as well. And with that, I just want to thank all of you for your time and attention. And again, to Dr. Rodriguez for nominating me amongst these incredible colleagues in the AANS CNS tumor section for allowing me the opportunity to be represented here today. Thank you.
Thank you, Sabrina. This is impressive, and we apologize for not adding all your titles after your MD just because of space. So apologies.
Understood.
So I think Ganesh is here, yeah?
All right. Dr. Germano, if you go to his, John Shin, who unfortunately is on a flight and was unable to be here, nominated Dr. Shankar, but since I have known him for so long, I consider him a friend and a colleague. I'm happy to do the intro. Ganesh completed his residency at Mass General. I've known him for almost at this point 15 to 20 years. During his time at MGH, he was known as one of our best residents. And then he completed a postdoctorate fellowship during his 2 years in the lab, where he developed a very novel assay, which he termed at the time Sniper, which really changed the way we look at mutations and mutational analysis and even mutational detection, and led to many of his pivotal discoveries later on. It was such a novel thing at the time. He has since had patents and a lot of interest. After residency, he completed a complex fellowship in spine at the Cleveland Clinic. We were lucky to recruit him back to MGH. Very quickly, he's risen through the ranks. He's one of our busiest surgeons. He's our assistant program director on the residency side. Clinically, he specializes in the complex management of not only spine trauma, spine deformity, spine oncology, spine, you name it, he can do it. And he's one of our favorite spine surgeons at MGH. Scientifically, despite being one of our busiest surgeons, he has an incredibly productive lab. And as I mentioned, some of the assays that he did as a resident has led to several pivotal papers, which I'm sure he'll highlight today, changing the way we now diagnose lymphoma at MGH. And hopefully obviating the need for biopsies moving forward. He's done a similar work in GBM in the microenvironment, with papers yet to come. He's the director of our biospecimen banking, which I just learned about today. And he also leads a novel project on both bone pathology as well as biology, both in degenerative diseases as well as oncology. With that, I will turn it over to Dr. Shankar.
Well, thank you so much for that, Brian. Obviously, your mentorship, but very much your friendship has meant a lot to me. And I'm very grateful for this opportunity to be here today, and also grateful to Dr. Shin for nominating me for this platform. This is really fantastic and gives us a chance to continue to build this community. So very grateful to be here. It's very hard to follow on the heels of what I've already heard here. It's very impressive and very humbling. And so I have just a few things that I can share. My interest in spine oncology really started when I was training as a resident here at MGH. I really fell in love with spine anatomy, and I felt that the molecular biology of spine oncology really was untapped at the time. The TCGA was just starting to characterize various solid tumors, and I felt that there was a number of spine oncology, metastatic diseases, primary diseases of the spine that I really wanted to work on. And I had the good fortune of working in Dr. Matthew Meyerson's group, who shares his time between the Broad Institute and Dana-Farber. And through that, we were able to characterize the genomics of various tumors, including spinal cord astrocytomas, and other cranial tumors as well, such as rhabdoid meningiomas and papillary craniopharyngiomas. So there's a lot that I learned from that whole experience. And as Dr. Nahed was mentioning, I wanted to translate some of those discoveries that were being identified around the world at that time into key measures that we could use to guide our intraoperative or now even our preoperative decision-making, so that we don't necessarily need to subject patients to the type of surgery that we see here, which was, from an anatomic standpoint, I'm really drawn to these procedures from a technical standpoint, but these are really morbid. And the goal of a procedure like what we see here is to establish a diagnosis. So it's really, more than anything else, a biopsy with a expansile duroplasty so that it can augment the patient's treatment course. The goal was really to take what we knew on the genomic side to translate that towards improving diagnostics, as you can see on this bottom picture here. And over the years, we've translated a quantitative PCR-based method that was optimized for solid tissue testing on an intraoperative timescale. What we realized is that that approach also worked on CSF for the cell-free DNA, as well as on plasma. And in a pilot study that was published now 2 years ago, we were able to show as a proof of principle that this approach could be used on cerebrospinal fluid to identify the hallmark mutations of lymphoma. And that's now been translated to a number of other assays that we've developed, are CLIA certified, and we've seen them get operationalized into our clinical domain to a point that patients can get initiated on treatments with a diagnosis that's established on just a CSF-based test. And that's, that's basically, I would say, for me, it's a dream come true, but it's only been enabled by the incredible environment that we have here. It's been a huge team-based effort from the neurosurgical oncology community, the neuro-oncologists, neuropathologists, and operationalizing this has really been a wonderful journey. And I know there's a lot more work to be done, not only to expand its use here at MGH, but really to break this approach outside the walls of MGH as well. We can go to the next slide. And so, there's a lot of things that I would like to continue working on from a scientific standpoint. Very interested in degenerative disease of the spine and understanding the basic mechanisms of why spinal stenosis happens or how failures of fusion happen, really understand that at the mechanobiology level. We have really fantastic talent working on questions like that here in a very collaborative environment. From people like Mo Hatzipasek, who's a chief resident, Ian Connolly, who's a senior resident in the lab right now, who are just doing groundbreaking work. And oftentimes I feel like I'm just lucky to be going along for the ride, but just really seminal discoveries as to why those types of disease processes occur in a way that we might be able to come up with better non-operative strategies for those patients. And similarly, really understanding the molecular biology of both primary and metastatic diseases of the spine. So we have projects related to that, and all really depends on having a well-annotated biorepository. So we have pretty extensive IRB to allow us to collect specimens and clinically annotate specimens so that we can go back and understand the disease evolution for patients. In addition, I just absolutely love not only my time in the operating room, but I also really love the multidisciplinary approach of spine oncology. From a surgical standpoint, medical oncology, radiation oncology, palliative care, and most importantly, with the patients and their families. I find that to be a very important interaction that we get to have. It's a privilege to be able to intersect with people at such a vulnerable time. And it's really through the guidance of people like John Shin, who nominated me for this, who have trained my appreciation for surgical anatomy and how to ensure the best outcomes for patients when they're in the operating room and post-operatively. And so, I think there's still a lot to grow from a surgical technique standpoint. And I'm very lucky to have incredible partners and mentors here, both on the cranial and spine side. And then The goal ultimately is to find a way to move away from big surgeries to surgeries that can be driven more in a precise fashion from a molecular biology standpoint. Just some personal tidbits. Obviously, the most important parts of my life all are at home. Very, very privileged, very lucky to have an awesome wife who's an emergency medicine physician over at the Brigham, and 3 lovely kids, as you can see in this picture here. Just the absolute love of my life. I love to run. I don't have as much time to run now as I used to, but Boston's a great flat running town along the river. And then I do have to say that I'm a Lakers fan who's been in Boston for the last 20 years. And that's, it's been challenging, but maybe next year we'll see the Lakers and the Celtics pull off a championship round. So thank you again. Very humbling to be here amongst this crowd. It's truly an honor, and I look forward to continuing to be a part of this community.
Thank you so much.
Well, I think that wraps it up for the group. Dr. Germano, any closing words, and then Susan and I can take it home.
Well, I think that this is a fantastic panel. We have really enjoyed your presentations. As Isaac, I think, said before, the future is really bright with you as the leaders, and we're looking forward to interacting with you, seeing you. I wanted to thank Dr. Nahed and Dr. Pannulo for organizing this series. I think it really helped us getting to know each other a little bit better. This is our last episode, unquote, of this, and who knows what the 2 of you will come up with next. But this has been a wonderful opportunity to be with all of you.
And a credit to Dr. Germano, who's always so humble and was really the reason we even brought this entire group together, a new initiative under her leadership. And it's been not only fun getting to know many of the members in our own executive committee, but opening it up to our entire tumor contingent in the US and even internationally. And to all of you as our future leaders, we hope you'll engage with us on the executive committee, and hopefully you'll be in that group as well. I've been super, super lucky to learn a lot from Dr. Germano and Dr. Pannulo. And so with that, thank you all. I'll turn it over to Dr. Pannulo for the final word.
I just have to echo what you said. I think this has just been a really wonderful and energizing experience to see people who are on the senior end of things, and then all the way down to people who are up and coming and really very strong forces already. As you said in the beginning of this program, I really have enjoyed doing this very much, and I'm grateful for your leadership and for Isabel's as well.
Awesome. Well, thanks, guys.
Thank you.